Okay, so today we're going to be doing a knee-spanning external fixation construct. I have here sawbones models of a femur and a tibia. To do this, what we're going to do is, of course, we have our drill and our drill guide because we have non-self-drilling pins here. I've got two larger pins that we're going to put into the femur, accounting for the larger amount of soft tissues. And we're going to put two pins into the tibia with these smaller sides. We've got our clamps here. We've got a bunch of our large rods here. You want the largest ones that you have. You'd probably go with the second largest if needed, but I think just to give us enough space, we're going to use these guys. And the concept is we're going to put two pins into the femur, two pins into the tibia, and create our little handles. So one rod and two clamps for each bone. And that will allow us to manipulate the bones and get our reduction. And then we will create the provisional bar and two clamps to get the reduction and hold it, and then we'll add a second neutralization rod to firm up the construct. So I'll go ahead and get started here with my drill and my drill bit. So what I'm going to do is place these pins on the anterolateral aspect of the femur, which is fairly typical. You don't want to go directly lateral because it can irritate the iliotibial band. Going directly anterior can affect the quadriceps muscle. As they contract, it can sort of move around the pins, and that can cause pin site infections due to the inflammation. So I'm going to come down into the anterolateral position, and we're going to place our first pin. And just for speed, I'm going to put these in on power, but you can certainly put them in on hand, and that's actually preferable because that will allow you more control. Okay, so that's our first pin. Now we'll do our second pin. And you can space these out, wherever it makes sense, and they don't necessarily have to be parallel. In fact, you'll increase the pull-out strength if you make them not parallel. So I'm going to do that a little bit here. Just slightly off. All right, so two pins in the femur. Now let's do the same thing for the tibia. And for the tibia, we're going to put the pin sort of on the anteromedial aspect. That's the safe zone for the tibia, all the way from the proximal tibia all the way down to the medial malleolus. So plenty of space here on the anteromedial aspect. Eliezer, do you mind just holding the tibia for me, just so it doesn't tilt just here down at the ankle? Thank you very much. All right, and so we'll pretend that there's a tibial plateau fracture, knee dislocation, distal femur fracture, whatever the issue may be. So I'm going to come down here towards the shaft of the tibia. And just to expedite things a little bit, I'm going to drill both my holes now. Obviously, you would do this sequentially in a real patient. Okay, all right, so there we've got our two pins. So now the next step is we're going to create our little unilateral frames. So I'm going to use the long rods here, so there's plenty of overlap between the two of them. And I'm going to put one on here and one on here, and we'll do those with the clamps. So I'll do them sequentially now. Okay, and we're going to make sure that we've got sort of 2 to 3 finger breadths above the bone or soft tissue, just to allow plenty of space for swelling, if there was any swelling in the patient, you know, after trauma. Tighten these clamps down. Okay, so we'll just set that to the side while I finish up on the femur. And again, you know, we're accounting for the soft tissues here, hence the longer pin, so leaving plenty of space here. You want to be sure that there's plenty of room for the patient's swelling and soft tissue injury. Okay. So again, we have these 2 clamps, our unilateral frame. We're just going to tighten this down. All right, guys, so what we've done is we've put our unilateral frame on the tibia. Now we've done the same thing on the femur with 2 clamps and 1 bar. So I'm just tightening this down fully. So that's creating a construct now, a unilateral construct. So now we basically have our 2 modular pieces, right? So I've got control of the femur, I've got control of the tibia. And that allows us to get our reduction of the knee or tibial plateau or whatever the case may be. And now we're gonna do our rods in between these 2. So the first thing I'm gonna do, I'll actually use one of these shorter rods because I think that's plenty, that should give me plenty of space. And I'm just gonna put these on provisionally, get the reduction, tighten them down for provisional reduction. And then we're gonna shore it up with a final neutralization rod. Okay. So here we've got our sort of rod in between that's still allowing a little bit of motion. So I can get my provisional reduction of the knee here, and otherwise I'll just have you hold it for me if you don't mind. So holding a perfect reduction here of the knee, thank you so much. And then we'll just provisionally tighten this rod down. Good. Okay, so that's our provisional reduction, now stable. Now what we'll do is we'll add a second rod and clamp, second rod and 2 clamps as a neutralization rod. Now there are a couple of different ways you can do that. You can use a long one and go from this rod all the way to this rod here, or basically connect this rod to this rod, and that's what I'm going to do. Basically you just want something connecting this construct to this construct again. So I'm just going to add a second neutralization rod here. You can add it here, you can add it anywhere you like, but it basically is preventing the torque rotation through individual clamps holding just 2 bars like this. So I'm going to add another bar and 2 rods right here. Do you mind just holding right there, Lorenzo? Thank you. There we go. Okay, so that's our final construct. Now we're just going to tighten it down fully. All right, so that's fully tight. We're just going to check all of our nuts again, make sure everything's tight. Excellent. Good. Okay, and that's our full construct now. So we created our unilateral frames, our little frames on each individual bone. Then we used a single rod to create our provisional reduction, and then our second rod as a neutralization rod to finalize the construct. So that's going to be super stiff, holding our reduction. Thank you.